My name is Larry Hoffheimer, and I am the founder and chairman of the Macular Regeneration Association. I want to thank our sponsors, which include Regeneron, Apellis, Novartis, Alexion, and Nodal Vision for their support of these programs. The virtual programs will continue, but more importantly, we'll be doing in-person programs as we have in past years prior to the pandemic. The Macular Regeneration Association is an IRS recognized 501c3 organization whose contributions are tax deductible, and we raise a good part of our money from voluntary donations. We have two medical directors. One is a retina specialist, Dr. Joshua Bali, and the other is an optometrist who's going to be speaking shortly, Jeffrey Gerson. Dr. Gerson is probably one of the best known optometrists in the country and has participated in numerous seminars and events. He's published several articles in scholarly journals and is experienced in cutting-edge diagnostic technologies in clinical trials. His expertise and knowledge have earned him the title of the Kansas Optometric Association Young OD of the Year. That must have been a long time ago. And where Dr. Gerson practices at the Grin Eye Care in Leawood in Ola, Kansas. He will be interviewing one of his patients who's living with macular regeneration, Miss Chris Rodenbaugh. So without further ado, I would like to present Dr. Gerson and Miss Rodenbaugh.
Thank you, Larry. And thank you to everyone that is on the webinar today. Most importantly, I'd like to thank Chris. And so, as Larry said, I'm an optometrist, and Chris is one of my patients. And so the idea, like Larry said, was to have someone talk to us from a real experience perspective, not a doctor, but someone that's in the same shoes as you are. And when Chris was in just a couple of weeks ago, I was telling her that she embodies the ideal patient with macular degeneration because of how she's really changed and taken care of herself. And so I wanted everyone to see that, because I know a lot of times people talk about with macular degenerations getting injections and the wet kind of macular degeneration. But as Larry said, the majority of people that have macular degeneration have the dry kind and are doing pretty well and want to obviously continue to do well. And so that's why I think Chris is such a perfect person to have on today, because she really exemplifies that. So with that said, Chris, do you want to tell us a couple things about yourself and how young you are?
How young I am? Well, let's put it this way. In about a month, I'm going to be 74. And I have been, I grew up on a farm, milking cows and all that stuff, walking to a one-room schoolhouse, walking a mile each way, winter and, during the good weather. And then family moved to Kansas City, Kansas. And then I got married later on and have two children, and one is deceased. And after my second child was born, I was a little hefty in my weight and I didn't like it. So I joined a weight loss management group, and I have been a lifetime member for 47 years, missing 1 month. So health is important to me, especially my food. I've got to have food. And I exercise all the time. I've done race walking. I've done a 25-mile walk one time, and I swim currently 3 times a week for 45 minutes, doing 4 different strokes. And my hip has been bothering me, so I haven't swam for a week. So, but next Monday I start back at the pool. So, and I eat healthy, and if I don't eat, my body tells me. And I do my eye drops several times a day. First thing I do in the morning when I get up is do my eye drops. And last thing at night as I do my eye drops and carry them with me all the time. So health is important, especially my eyes. And also, I think I was born with cross-eyed syndrome way back when, and I had surgery on that, and I couldn't tell you when I had surgery on that. And I have had both my cataracts taken off, and I wear my glasses and do my drops and take my eye medicine, and I follow the rules.
You you do. Yeah, so what I told Chris, the other day is she's a really young 73. She's remarkably young for her age, and that's because of what she just mentioned to you about her healthy lifestyle. And lifestyle, like what she's talking about, is so important in macular degeneration that there are numerous studies that talk about that when you take good care of yourself, when you have a good diet with more green leafy vegetables and less refined carbohydrates, and when you exercise, you do better. And so a statistic that I'll throw out for everyone, because Chris mentioned she swims 3 days a week. And so she and I have that in common. I try to swim at least 2 days a week, but sometimes 3. And actually, Chris and I both were telling each other that we get cranky when we don't swim. That
That's true.
it's just a part of our being. But I think it's important to do some sort of physical activity. There was a study that said that if all you do is walk 1 block a day, that you decrease the risk of developing wet macular degeneration by about 50%. So you don't have to swim 2 or 3 days a week like Chris and I do. Just going for walks can be really good for you. So what Chris does is exemplary, but realize that you don't necessarily have to do as much in order to still get some good. Now, Chris, you've been a patient of mine for about 2 years. And when you first came to see me, you came in and you said, you had a little bit of blurriness, a little bit of dryness.
Mhm.
And there was a question that came in about what drops. So Chris uses some drops for her dry eyes. So the drops that she uses are not for macular degeneration. We'll get to what she takes for macular degeneration in a minute here. But she uses drops for her dry eyes. So when I first saw her, we'd started hot compresses for the comfort issues. And when I first saw her, she was taking a vitamin for her eyes. She was taking 1 a day. And when she came to see me, that was really the first time we had a discussion about macular degeneration. And I think that was the first time you'd really been told about it. And I
Mhm.
know you didn't have a family history of macular degeneration that you knew about. Do you by any chance remember 2 years ago when we first started talking about macular degeneration, what you thought about it?
I couldn't tell you. I just followed what you say.
Well,
And
that's actually, I would tell you that's a good answer. And the reason I think that's a good answer is because I can tell you that one of the things that I try not to do is to get people too worked up or create undue anxiety.
right.
And so if all someone says is, I don't really remember, I just remember, you said that this is what we need to do and I'm doing it, to me, that's a perfect outcome. And so hopefully those of you that are listening have similar experiences, that you have a doctor that can kind of help walk you through it. So one of the things that when you first came, you were taking a vitamin called Preservision, and you
Mhm.
were taking 1 a day. But I
Right.
think that's changed since then, right? You're taking 2 a day.
Yes. Yes.
Yeah. And tell the audience what else you do on it's not quite daily basis. So it's on about an every other day basis
Well, with my medication or with what? My
with
medication.
with the monitoring instrument.
Okay, I do the eye testing 3 times a week. I try and do Monday, Wednesday, and Friday. Sometimes I skip one of the days, but I try it 3 times. So I'm pretty regular with that, at least 3 times. The days may vary, but I do that. First thing after I get up and get the morning going, I do that. And don't want to leave the house without it.
No,
So,
that's great. So what Chris is talking about is the 4C home. So it's an instrument for people that have macular degeneration at the stage that she does the testing at home, so that if there's ever a change, it will alert us at the office. So even though she only comes to the office a couple times a year, kind of the office is extended into her home where she can test herself. And what she's doing is three days a week. Chris, do you think, does that testing make you feel more comfortable or less anxious knowing that you're doing it and that everything's going okay?
Yes, that is very soothing for me to know I'm doing what I am actually practicing what you preach. And that makes me feel good that I do that because I want to have my vision because I had poor vision when I was young and I don't want that anymore. I want
Yeah,
to be able to see life.
yeah, absolutely. And when you do that testing at home, is it easy? Is it difficult? Or and how long does it take each day?
It takes less than maybe 5 minutes. It's easy. You just have to sit down, turn the machine on, and be able to read right and left and punch the button. So it's very easy and it goes very quickly.
That's great. So really it sounds like for 5 minutes a day, it allows you to really feel at ease and less anxious,
Right,
knowing that you're doing okay.
right. And
Yeah.
that's what I have to do to keep my eyes. I'll do it.
Yeah. And Chris, do you know how much that costs you?
No, I do not, because I haven't got a bill and I think it's probably covered all by my insurance.
Yeah. So that's why I ask, because for majority of people that have Medicare, it ends up costing nothing. And
Okay.
so it's really something that I wish more eye doctors would talk to their patients about, because it's been shown to be really effective at catching change early. And so if you can have something that helps catch change early and it
Right.
doesn't cost anything, then that's a win-win. But I bet you would tell me that even if it did cost something, you'd be happy to do it.
Yep, I sure would. Anything to save my vision.
Yeah. Yeah.
And I even take it on vacation with us when we go to the lake. So,
That's that's great. Yeah, because it's pretty easy to carry it comes with a case that you can carry it
uh-huh,
in, right?
right. Yes.
Yeah. Yeah. So what sometimes happens if people go on vacation and they don't take it with, then the company that makes it, they'll reach out to them and find out, hey, what's going on? Why aren't you testing? It's been a couple weeks, because they want to make sure that you're testing and doing things as you need to in order to keep your vision the way that it is. So
Right.
so
Right.
man, you're doing that just perfectly. So you mentioned about trying to eat healthy. So
Uh-huh.
tell us a little bit about the kinds of foods that you eat and what you enjoy, and what makes you think that you eat really healthy.
Well, I know I need protein. My body tells me that. And I know I need my veggies and my green veggies, my different color veggies. And I need protein and veggies and I need my fruits and I do my dairy. And if I don't eat those, my body tells me it's time to get them. And I am a grouch. I will say that. So nothing comes between me and my food. When we go out in the car running errands, I've always got veggies with me or a fruit. And I take a little bottle of chocolate milk for protein. In fact, that's what I've got ready to go at for my blood test after this. It's all packed and ready to go in the car. Can't forget my food. Food to me is the top thing.
Yeah, and it sounds like you're eating the right foods, and that's something that's really important, that people realize that the right foods can make a real
Right.
difference.
Right. And I do liver, beef liver sometimes. So liver and onions, and I'm the cook, so we all eat it.
And so it sounds like you have a very varied diet, so it's not just any one thing, which is also really important to
Right.
have good variety, especially the fruits and vegetables that you eat. So,
Right.
Chris,
And
we
go
have a
ahead.
couple. Yeah, I was gonna say we have a couple questions that came in. So one of them is, have you noticed any vision loss? Have you had any change the vision over the last couple of years?
No, I don't think so. I mean, I think I'm doing the same thing. So I know when I get tired and I can tell when my eyes are dry, it's time to put some drops in them.
Yeah, so let's talk about that for just a minute, because having dry eyes and having dry macular degeneration are two totally separate things. They both have the word dry in it, but they're very different. But as it turns out, dry eyes is a pretty common thing for in the age group of people that have macular degeneration. So it sounds like you use drops, some artificial tears a couple times a day. Is that right?
Oh, more than that.
More than
Um,
that.
yeah, I've always got it with me because I'll do it before when I get up, do it, and then after I swim, I do it, and then during the afternoon, depending on what the humidity is and how busy I am, I've just always got them with me.
Yeah.
So
Yeah, and so with Chris, we actually a few years ago did something that's called punctal plugs. And basically what that means is our eyes produce tears and then the tears drain out. And what these little plugs are they're the little plugs that go in the drain. And so it keeps the tears in her eyes a little bit longer. So hopefully they don't dry out as much. So, and again, the only reason I point that out is just because someone has macular degeneration, it doesn't mean they will or won't have any other eye conditions. And Chris is managing both the dry eyes and the dry macular degeneration really, really effectively and doing really well. So Chris, we had someone type in that it sounds like you're really active. Do you have any limitations either because of your vision or the eye dryness or anything else?
No, I don't think so. Just make sure I got my drops
Yeah.
and I'm good to go. And take my machine with us when we go. And yeah, it's just part of it. And something I left out of my diet. It's very important for me to have oils, the fat. I make my own almond butter in the oven and blend it up. And I have that when I get super hungry, I go for a tablespoon of that on a cracker or something. So that fat also helps me.
It does. And you know, what's interesting is having some fat like that helps when you take your vitamins, that your body will absorb the vitamins better and use them more efficiently when you have some fat with it. So some people might think, well, all I'm going to eat are fruits and vegetables and very, very lean, no fat, but actually you do better if you have some fat. So that's just another example of how your diet is really just super. So Chris, do your friends know that you have macular degeneration?
No, not really, because they're used to seeing me wear glasses when I read and stuff like that. And I've probably told my sisters, but I've got 2 older brothers and 2 younger sisters. And I think I'm the only one. I know my oldest brother has, he wears glasses all the time, basically. So I've never really asked him. He's never mentioned it. So, but I think I will investigate now.
Yeah, so I would bet that if you have 4 siblings, chances are at least one of them also has macular degeneration. They may not know about it. And
Right.
so unfortunately, a lot of people that have macular degeneration just don't know it. So I think you bring up a good point. It's a good discussion to have. Just say, hey,
Right.
this is something that, that I'm dealing with and I've got it under control. You guys should ask your eye doctors about it and see if you
Okay.
have it. If you do, to start the vitamins like what you're doing.
I will do that.
So there was a question that came in, what are the chances that Chris will experience wet macular degeneration? So what I can tell you is, knowing what her eyes look like, I can tell you that the 5-year risk for her developing wet macular degeneration is about 40%. But the key thing in Chris's case is that she's taking the right vitamins, and that decreases risk by about 1/3. And she's doing the 4C home testing, which if she does develop wet macular degeneration, she'll catch it really early, probably before she ever notices any change to her vision. So for someone like Chris, who's really set up with all the right tools, even if she were to develop wet macular degeneration, the likelihood is that she would do really, really well and really not have any issues. Question came in, do the eye vitamins work for everybody? And they don't. And so when you take the eye vitamins like what Chris is taking, in general, it reduces risk of the dry macular degeneration getting worse, but they don't work for everybody. So, but I think they're definitely worth doing. And I think just as or more important than just taking the vitamins is having a more holistic approach like what Chris does, where it's diet, exercise, vitamins, and just really healthy lifestyle is what's really, really important.
Right.
Chris, did your diet or exercise routine change much after you learned about macular degeneration?
No, I think I just started swimming more and really thinking about what I do now instead of just doing it.
Yeah,
So,
more purposeful.
right. And I'm not sitting too much, that's not my thing. So we're only here for a short time, so we gotta make it count.
Yeah, always on the go. Let's see. So there's a question, do other medical conditions affect macular degeneration? So really the biggest things that affect macular degeneration are genetics and age, and then the lifestyle habits and smoking. And so Chris doesn't smoke.
Nope.
And I don't think you have high blood pressure either, do you?
I've got just a little bit. I take a blood pressure medicine, but it's not very high at all. And I
Right.
have a thyroid condition. I have to take that medicine.
Yeah, so if someone has high blood pressure like Chris, the best thing you can do is control it, and that is beneficial. If you have high blood pressure, it's not controlled, that could be a risk for macular degeneration. But there aren't too many systemic conditions that have too much effect on macular degeneration. So Chris, do you ever think about, what would happen or could my macular degeneration get worse? Does that ever even cross your mind?
No, it doesn't. I'm in the moment, I guess. Today is I'm living, and this is what I got to do. And I don't think about down the road too much.
No, that's a fantastic attitude, because, macular degeneration is just one of many things that we could choose to worry about, and the worrying doesn't do us any good. And
Right.
instead, we're better off concentrating on all the positive things we can do, like exactly like what you're doing.
Yeah, and I also drink the water.
And you drink lots of water. Yeah. Yeah. So you basically just do everything that, if you look up, what do I do to be healthy? You do all those things.
Yeah, and I don't drink soda or any of that. I'll drink hot tea in the winter, but no iced tea in the summer. So
you bring up tea, and what's interesting is tea is actually a pretty good source of antioxidants, which are important for macular degeneration. So that's just yet another step you're taking that is helping to be preventative for you.
So I need to be drinking more iced tea then.
Well, I mean, you could. The problem with iced tea is when you load it up with all kinds of sugar. So,
yeah, it's a sweetener.
You're right. So if you drink tea, that's a step forward. Then if you put a bunch of sugar in it, it's 2 steps backwards.
Right.
So we have a question that came in, Chris, that you mentioned reading. Do you have any issues with reading at this point?
No, I'm just fine once I find my glasses.
Right. So Chris's vision is right about 20/20. So she sees fantastic. But when I look in her eyes, or when I do the scans of her eyes, she has pretty noticeable changes due to macular degeneration, which, the important thing there is you can certainly have macular degeneration and have great vision. Chris, do you notice that you need more light to read or do things than maybe what you used to?
No, I've never noticed. I'm a habit person. You turn on the light when you want to read, and you make sure there's plenty of light when you're reading.
Yeah. It's a good question, because one of the things we know is that people with macular degeneration don't see as well in the dark and have a harder time going from a light room into a dark room. So lighting can be something that's really important. So it looks like you're in a room there where you're sitting at a desk and there's a window and some really good lighting. And so that'd probably be an ideal place to be able to do some reading.
Right.
So one of the people typed in, one of our viewers typed in, is there a difference in the quality of eyeglass lenses? And the answer is yes. So especially if you have the no line bifocals like what Chris has, then the quality of lens makes a big difference. It doesn't make quite as much difference if a line focal, but if you have the no line bifocal, then it really does make a difference, because if they're not lined up right, or if they're a little bit lesser quality, it really does affect the quality of your vision. So there's another question that I'll answer, but I want to make sure people send in questions specifically for Chris, because this is a great opportunity. So one of the attendees typed in, I have wet macular degeneration. Does PreserVision help? Do the vitamins help? And so that's kind of a trick question. The answer is kind of both yes and no. Once you develop the wet kind of macular degeneration, then the vitamins don't prevent the wet macular degeneration, because you already have it. But because of some of the things in the PreserVision AREDS 2 vitamin, the lutein and zeaxanthin, it actually helps improve the quality of your vision a little bit. So even if it doesn't prevent wet, it can still help the quality of your vision. So someone typed in that they don't understand how you can have 20/20 vision in macular degeneration. So Chris, do you think your vision's much different today than it was, let's say, 10 years ago?
No. When I was a child, I had cross eyes, and they did surgery on that. So my left eye, I believe, or I've been told, is a little weaker than my right.
It is just a little. Yep. Yeah. So some people can have dry macular degeneration or even wet macular degeneration and still have 20/20 vision, just like Chris does. And so Chris is very fortunate that her vision is so fantastic. So not everyone with macular degeneration has poor vision. All right, Chris, what would you tell someone who is just diagnosed with macular degeneration?
Don't get too upset about it. Just intermingle that into your regular routine and know you have to start taking care of your eyes and taking care of your body, just not your eyes, your body, your food, your exercise, your water, all that stuff impacts what you do with your life. Get up
Yeah.
and move. Don't sit all day long.
No, that's great advice. Don't let it slow you down is basically what you
Yeah.
would tell somebody.
Yeah.
When we first talked about vitamins for macular degeneration, did you think it sounded weird that to do something for in order to help your eyes that you were taking a vitamin?
Nope. I figure that's another part of aging. Just,
Yeah.
one more thing.
Yeah. Yeah.
But it's no
Uh,
big deal to put that in my medicine for the month and, take it.
It's just part of the routine.
That's right.
So there's a question, are there other treatments for dry macular degeneration besides the vitamins and lifestyle? And the answer today is really no, there's not. There are some things that are in clinical trials that may come out and may ultimately be beneficial for someone like Chris. Right now, though, the best we have are taking the right vitamins, and Chris takes the exact right formula, and then just being healthy. Those are the two most important things that you can do if you have dry macular degeneration. And then the thing I would add on top of that is monitoring your vision. So ideally with the system that Chris uses, but even if not that, at least to, on a regular basis, cover one eye and see how things look, cover the other eye, and make sure there aren't changes over time.
Okay.
Chris, have you ever used, because I know you do the 4C Home, the instrument now, but did you ever use a grid? Sometimes people get a grid with a bunch of lines on it and are told to look at the lines on a grid to see if they change.
No, I've never done that.
Yeah, so a lot of times that's what people use, and because it's perceived to be less expensive, although like you said, when you do your 4C Home, it doesn't cost you anything. The lines on a piece of paper, it doesn't work nearly as well as what you're doing. And so what you're doing is really state of the art, the best that you can do, whereas the paper with the lines might be better than nothing, but it's not nearly as good as what you're doing. But a lot of people do that. And it's important to monitor vision one way or another. Someone said they have dry macular degeneration in both eyes after cataract surgery in the right eye. It looks like they had a problem. Should someone with dry macular degeneration have cataract surgery? So there's been a couple different studies that show that if you have dry macular degeneration and you need cataract surgery, that you should have it, that it doesn't make things worse. So that's really important to do whatever you can to optimize your vision. Chris, someone's asking what are the correct vitamins for someone to take. So tell us exactly what vitamins you take. And actually, I want to also know where you purchase them.
Well, I get a lot through Costco. That's where I get my Preservision, and I get my eye drops, and I take a multivitamin. And I should have looked this up. I take a multivitamin. I take a calcium. Let me think. Off the top of my head, I'd have to go through the list. I should have brought my list here.
Oh,
But
no, no.
I take vitamins to help me.
Yeah.
That's why they're there. And food.
Yeah, well, you're right. The best way to get your nutrition is with the right food.
Right.
So what Chris mentioned, she takes Preservision Airids 2, and that's the vitamin that we know is helpful for someone with what's called intermediate dry macular degeneration. So that means it's more than just a little, but it's certainly not wet. And so there's a specific formula, and that's what Chris takes. And we also know that you do better if you take a multivitamin along with that.
Yeah,
So a multivitamin doesn't replace the macular degeneration vitamin. The macular degeneration vitamin doesn't replace the multivitamin. They go together. So I think that's a really important thing that, again, I'm like a broken record. Chris is doing the exact right thing. She's doing exactly what anyone would say is the best practice for trying to make sure that she doesn't have any changes. Chris, let me ask you, do you have any unanswered questions in regards to macular degeneration?
Well, I haven't looked it up. I've gone by what you've told me and I've followed your suggestions, but it sounds like I need to do a little investigation on my part to be responsible for more of my health. I've just never sat down to investigate it. I just go day by day.
Well, that's not all bad, because, hopefully what people can do is when they go to their eye doctor, they can feel comfortable and trust in what they're telling them so that they don't have to worry about it. So I think your attitude with what you're doing is actually perfect, because you don't think about it too much. You don't let it bother you, because like you said, there's no reason to let it bother you, or to let it become a question.
Yeah,
So
you're only here for today, for sure.
yeah. And I bet if I were to ask you if you have any fears in regards to your eyes and vision, my guess is you're going to say no.
No, I tell 'em I live for today and don't worry about the future too much. Make sure we've got food and shelter and money in the bank. I'm good to go.
There you go. No, I
And just
think that's,
and make sure I exercise and eat right. That's the top of the list.
yeah. And what's interesting is we've said that a couple times, but it's because it's so important that makes more of a difference than people really realize.
Yeah,
And to start doing something for exercise is pretty easy, and it doesn't have to be expensive, and it's accessible to everybody.
right. And also on my food, I eat my 3 meals a day. Then I have snacks in between. And if I don't get my snacks in between, watch out. So
You get cranky.
yes, I do. I need my food.
That's funny. Well, no, it's important to know your body and know what works for you, or what doesn't work for you.
Right.
So someone wrote in, why does the print in books and papers look faded? So for some people, it can look a little faded if you, whether it's from macular degeneration or something else, it can cause a change to what's called your contrast. So print in a book, is, we think of it as being black and white, but oftentimes it's not. And so when things aren't as black and white, it's harder to see. And so that's why sometimes things may look faded. But one thing that can oftentimes help if print in books or magazines or whatever looks faded is better light. So like where Chris is sitting, where you can see a window and you have natural light coming in, that's perfect. So that's a perfect setting for where you would want to try to read something. So I know Chris needs to go in a couple minutes, so I'd love to know if anyone else has any questions specifically for Chris. I love the questions we're getting, because some of them are, certainly questions that she can answer that I can't, because she has the experience. And I love Chris's attitude of, you live once, and so do the right stuff and don't worry about it. I think that's just really great. That's really fantastic. So any other questions for Chris? So by the way, while I wait to see if there's any other questions, Chris is a champ. She was kind of a last minute fill-in. When I saw her at the office, I forget if it was last week or the week before, I told her about this webinar and said, I already have someone that I'd asked, but I'm not totally sure they're going to make it. They said they could, and could you be on standby? And so Chris said, sure, I can be on standby. And then yesterday I hadn't heard from the other lady that was going to do it. So I called up Chris and said, hey, Chris, can you help out tomorrow? And she said, sure. So I really, really appreciate that she was able to jump in last minute, and she's got stuff going on. And so she took some time today to be with us. So I'm really super appreciative of Chris sharing her experiences. And, the other thing I want to point out is I specifically, I did not want to have someone that had wet macular degeneration. And the reason for that was that I think, we hear about that a fair amount and the treatment for that. And I know there's lots of questions about that, but what we need to realize is the majority of people with macular degeneration are just like Chris. They have the dry kind and they do pretty well. And the most important thing is just knowledge. Chris, before I asked you, had you, or do you go on to any websites like patient support websites like Macular Degeneration Association or anything else like that?
No, but I think I probably should.
Well, it's an opportunity to learn, right? It's
Right.
just
Right.
an opportunity to learn or to hear from other people just like you.
Right.
Whether it's the Macular Degeneration Association website, that's macularhope.org, whether it's that or there's other ones also, but so macularhope.org, or if it's something else, they're just opportunities for education.
Right.
So I would encourage anyone to take advantage of resources like that. Chris, someone typed in, thank you, Chris, for your positive attitude.
Thank you. You're welcome. That's just my life. You make a decision in life early and you want how you want to live. And that's what I did. And it's paid off because I feel good. Don't realize I'm gonna be this old next month. Just hard to believe. But time goes by fast and you got to grab it while you can and build on it, because you've got your whole life ahead of it and you only have one life. How do you want to live it? And I don't want to live it in the hospitals and the doctor's offices all the time. And I want to be out there in the open air like I was when I was a kid in the country,
There you go. There you go.
So, but
Yeah.
thank you for asking me. This has been very informative for me to sit in on this. And I will do some more research. My profession before was an academic advisor at the community college, so educating other students. So you've educated me now, so I will get on it.
Well,
And
thank you. So I know Chris needs to run. She has an appointment, but I'll stay on for a few minutes and answer any other questions that anyone has. But again, Chris, thank you very much.
oh, you're welcome.
Don't forget your chocolate milk on the way out the door.
It's already in the car.
All right.
It's on my ice in my bag, and my red pepper all cut up, and snacks if I need extra snacks. So,
Perfect.
thank you so much. I'm gonna cut you off here.
All right.
Take care.
Thank you, Chris.
Bye-bye.
Okay, bye. So a couple other questions that came in. There's one that came in. Could you talk a little bit about research that is ongoing? So, boy, that's a tricky one because there's so much research into macular degeneration. Before I talk about the research, what I want to touch on is the fact that there have been several new drug approvals this year. So one was an injectable for wet macular degeneration that most people can go 16 weeks in between injections, which is a big improvement from 4 weeks or 6 weeks. And actually, that's the medication that Larry, who you heard from earlier, is getting. So it dramatically stretches out the time in between injections. And then there was something approved earlier this year that's called a port delivery system, where it's a little port that's put in the eye that slowly releases medication. And almost everyone that gets that does not need an injection or refill for 6 months. So those are two things that are new and approved and available. As far as research, there are other injectable medications for dry macular degeneration that are in clinical trials. There is a drug that looks like it's close to getting approved for something called geographic atrophy, which is another type of advanced macular degeneration that up until now, there's nothing for it. So that's really exciting that there might be a treatment for that. There's also a form of light-based treatment that is in trials for dry macular degeneration. So it's using a specific wavelength of light to try to help the cells in your macula kind of reinvigorate and become healthier and reverse macular degeneration. So those are some of the things that are in trials now. And, I've been at this for about 25 years. And boy, the things that are available now and the things that are getting close to being available are so dramatically better than what they were really not all that long ago. And so the person that was asking was specifically asking because they have geographic atrophy. So geographic atrophy, like I said, it's an advanced type of dry macular degeneration. That's kind of what it sounds like. There's atrophy in the macula, and geographic because it just kind of grows in its geography. And it's really under addressed because there's nothing we can do. it's underappreciated, I think, because there's nothing we can do. If there's nothing you can do, then sometimes it gets kind of maybe not missed, but it's not discussed as much. And so there have been a number of treatments that have been in trials and unfortunately failed. But there's one now that looks pretty promising, that it could very well be the first FDA approved treatment for geographic atrophy. When could you go swimming after an eye injection for wet AMD? Boy, that's a good question. Some of the ophthalmologists that I work with and I take a little bit different attitude on restrictions than others. And that is what's important to us, is to try to be able to lead your life the best that you can with the least amount of hindrances or restrictions. And so as far as swimming after an eye injection, I would probably say not the same day, but I think you're probably okay the next day, because when you have an injection like that, it seals itself. And so the risk is so low. So I think you're probably fine to go swimming the next day. Now, what I would say with that is I would ask the retina specialist that you're seeing that's doing the injections, but let them know, say, look, swimming's important to me. It's a part of my life, and it's what I do to try to stay in shape and stay healthy. How quickly can I go swimming after an injection? That's a really good question. I like that.
Wear goggles.
Wear goggles. Yeah, that's true too, Larry. I would definitely say to wear goggles. So are there any other questions that I can answer for you? All right. So hopefully you enjoyed hearing from Chris. Let us know. Let us know if you like that, because we're always looking for different things to do for our programs. And if you enjoy hearing someone else's experiences, then that's certainly something that we could look into doing again. Obviously, we could look into having somebody with wet macular degeneration talk with us. Larry could talk with us about that. Just wanting to know what you want to hear about to make this valuable for you. Larry, I guess it's back to you now.
Early intervention of wet macular degeneration is the difference between good sight and poor sight. Yes, the ambular grid is a substitute, but not, as Dr. Gerson said, not a good substitute. The 4C home is the technology of the device and its ability to catch changes in your potentially wet macular degeneration from dry is clearly the ambular grid on steroids, as I call it. You're going to hear from Dr. Megan Blepner, who has been a partner of ours, and she's an ocular disease residency trained optometrist who practiced in Nashville for 9 years. She's now working for Nodal Vision, where she serves as its Director of Clinical Affairs and Education. And she's going to make a presentation, after which she'll answer some questions about the 4C home device.
Thank you so much for the introduction. Notal Vision is proud to partner with the Macular Degeneration Association, and I appreciate the opportunity to speak to you all today. It is such a privilege. To reiterate some of the important points made in the presentation, I would like to further discuss understanding the importance of early detection of wet AMD and how you can play a role in protecting your vision. 4C Home is FDA cleared and Medicare covered and prescribed by your eye care professional when appropriate level of vision and stage of AMD. It is a form of personalized medicine with the 4C Home device used at home in between your regular eye exams. It detects metamorphopsia or visual distortions in AMD. AMD, or age-related macular degeneration, is the leading cause of severe central vision loss in people over the age of 50 years in the United States. I'm going to share with you the information you need to get informed and take charge of your vision. AMD is a chronic, meaning it does not resolve or go away, progressive, meaning that it tends to worsen over time, type of condition. And there are two types of AMD, dry and wet. Dry AMD is the slower changing, earlier form of the disease that puts you at risk for developing wet AMD. Wet AMD is the sudden change or advanced form of the disease. AMD affects an area of the retina called the macula, which is responsible for detailed central vision used for activities like reading, driving, and seeing faces clearly. In dry AMD, changes occur in the cells of the macula, and drusen, or deposits, build up in this area. These changes may induce blurry vision, such as difficulty seeing sharp details, both up close and from a distance. Dry AMD is the slow form of the disease with changes you may not even notice over time. Most importantly, dry AMD puts you at an increased risk of progressing to wet AMD. Over time, the size and number of these deposits can increase, which increases your risk of developing the more sight-threatening form, wet AMD. Again, dry AMD can suddenly change to wet AMD without any advance notice. If you convert to wet AMD, abnormal blood vessels grow under and into the retina in the macula. These blood vessels leak fluid and can sometimes bleed without any warning. You may not notice changes until significant vision loss has occurred. If you convert to wet AMD, significant vision loss can be rapid and severe. Symptoms of wet AMD include distortion, or straight lines that look wavy, and dark spots in the center of your vision, or generalized blurry vision, as you see here on the screen. Unlike dry AMD, there are effective treatments for wet AMD, but these treatments are most effective when administered early on before symptoms are noticed and vision loss has occurred. These treatments can halt or slow the progression of wet AMD, but they cannot restore vision that has already been lost. Once the wet disease starts, it will continue to advance until you receive treatment. Irreversible damage can occur within days to weeks and before symptoms are noticed. But how early is early detection? Once symptoms of visual impairment are noticed, those wavy lines or dark spots appear, then vision loss may have already occurred. The earlier you catch wet AMD, the better chance you have of preserving your vision and your independence. So, wet AMD treatments are most effective when the disease is caught early. 4C Home is an early warning system for your eyes. You use this device at home in between your regular eye exams. It helps people with dry AMD detect wet AMD before you even notice that visual changes have occurred. But how does it work? Well, you take a simple daily test that checks for tiny changes in your vision, and this test takes just a few minutes per eye per day. Data from each test is sent to your eye doctor as well as the No-Tal Vision Monitoring Center, the medical provider of 4C Home. If a change in test scores is detected, the monitoring center alerts your doctor. Your doctor's office will then contact you directly to schedule a follow-up visit. The AMSA grid was developed in the 1940s and has long been recommended as a simple and accessible tool you can use from home to monitor for changes in your vision. However, by the time you notice vision distortions on the AMSA grid, significant vision loss may have already occurred. Fortunately, new technology, such as the 4C Home AMD monitoring program, has been developed to detect tiny changes before symptoms are noticed and reports them to your doctor so you can receive immediate examination and treatment. Testing with 4C Home is easy. You turn on the device and look into the viewfinder to begin testing. A bump will briefly appear and then disappear. Use the mouse provided to click where the bump appeared and return to the center dot. Data from each test is sent to the No-Tal Vision Monitoring Center for evaluation and then provided to your eye doctor. Regular at-home monitoring is like brushing your teeth. It's a good, healthy habit you do every day to help preserve your vision. 4C Home allows you to take a proactive approach to protecting your vision. A clinical partner will be with you every step of the way. After the No-Tal Vision Monitoring Center receives a referral form from your doctor, we will answer any questions, verify coverage, and ship your device. Once you receive the device, the No-Tal Vision Monitoring Center will walk you through setup and training. You and your doctor will continue to receive feedback from the No-Tal Vision Monitoring Center. Our team will be sure to verify your insurance benefits and discuss with you prior to your acceptance of the device and getting started with the program. There are low out-of-pocket costs for Medicare patients. Patients with Medicare and a secondary supplement plan could have out-of-pocket costs as low as $0 per month. Patients with Medicare and no secondary supplement plan will pay around $15 per month once their yearly Medicare fee-for-service Part B deductible is met. Your doctor will send our No Vision Monitoring Center the referral order for you to begin the 4C Home AMD monitoring program. Appropriate candidates have a particular stage of dry AMD and vision level, which are determined by your doctor. You will continue to test regularly at home. If a change takes place, your doctor will be alerted and have you come in for examination. In summary, the No Vision Monitoring Center works with your doctor to remotely monitor your dry AMD, helping you retain functional vision throughout your AMD journey. Happy to answer any questions you might have. Thank you so much. Great. I welcome any questions from the group, and it looks like I have a few already here in the Q&A. So if you have questions, please type those in the Q&A section, and happy to reply. The first one is, I have early dry macular degeneration. Can I use this? If yes, how do I get it? Excellent question. So this technology is appropriate for the medium stage or the intermediate stage of dry AMD. So the best way to know if you're a candidate for this is when you're seeing your eye doctor, they will determine what level of vision you have, because you have to have a certain level to be able to take the test, and they'll determine what stage of AMD that you have if you're a good candidate for this. The next question is, my sister has wet macular degeneration. I am fearful that I will develop it too. Can I use this machine? So as Dr. Gerson had mentioned in his presentation, definitely genetics can play a factor in AMD and your risk level. As far as whether or not you'd be able to use the machine, again, it would be determined by your eye doctor as far as the stage of AMD that you have and what your vision is whenever they're testing you on the charts and during your exam. In order to get this machine, next question, do I need to see my retina doctor or my optometrist? Also a great question. So any eye doctor can prescribe this or can fill out the form that we need for the referral to our monitoring center to get you started. So this could be an ophthalmologist or an optometrist, of course, retina specialist as well. Great questions. Next one is, have there been false readings? Oh, I love this one. Very astute observation as far as any false readings with any kind of screening test or any kind of diagnostic test. So most tests will have false positives, or there'll be a time when it will alert the doctor's attention when the indicated change for the technology was not exactly what we were looking for. And this is because we want the test to be very sensitive. We'd rather have you come in for an examination and just rather be safe than sorry. We don't want to miss any change in the disease. So this gives your doctor a chance to bring you in and determine what's going on. But because the 4C Home AMD monitoring program is so sensitive, it's a vision distortion detector. And there are other things that can happen in this very important central part of your vision. But we always encourage, anytime there's an alert with 4C Home, we'll notify your doctor. And then oftentimes the result is they'll bring you in for examination and they'll see what's going on. And sometimes they may see some changes that are expected within your dry AMD, and they may modify your follow-up, your appointments, or perhaps the treatment that you're undergoing, the recommendations for monitoring you. Next question is, what are the costs involved? So we have at our monitoring center a patient financial services team who will be able to take your insurance information, research what, if anything, you're going to have to pay. And of course, this would be discussed with you before you ever get shipped the device. So there's no obligation, no contract, anything like that. We want to make sure you have all the information, and we'll do everything in our power to make sure that this is an affordable option for you. But we will make sure that you have that information before you ever get started with the program. Next question is, how can your doctor obtain the form for prescribing? So we have a couple of different ways that you can get more information. Obviously, if you go back to your doctor, tell them that you attended this webinar today and you learned a lot about AMD and about 4C Home, then of course, share that information with them. We have a website, it's 4chome.com, where you can go find more information in regards to prescribing, getting started with the program. We have a portion for patients and we have a portion for doctors on our website where they can get all the information. You can also give us a call and we'd be happy to provide more information. I think my information is shared perhaps as well on the website or within this presentation. So feel free to reach out to me personally too. Great questions. I have arthritis in my hands. Will I be able to use this? So as I mentioned in the presentation, there is a mouse that's attached to the 4C Home that you would need to use your index finger to click the button when you see the stimulus on the test. And so I think the best way to answer this question is, it depends. Again, since there's no obligation for us to, for you to move forward with the program, if we ship you the device and you get started and it's determined that you're having a hard time with performing the test, we can certainly take the device back and we take care of all the shipping to and from you. But most patients, I think that if they start using the mouse, they do find that they are able to perform the test. But it's an excellent question if you have a head trimmer or if you have a hand trimmer. Again, it just depends, but we can always give it a try. And if it doesn't work out, then we can take it back from you, but it's worth a shot. Next question is, I'm missing a good portion of my central vision. I have dry macular degeneration. Would this help? Another, it depends answer, and let's give it a shot. Because the technology is so sensitive and because it is looking at the very center of your macula, very center of your vision, then there could be a chance that you actually have a hard time even seeing the little stimulus that's presented within the testing device. So again, we could ship the device to you, you could try it out, and if you are able to establish a baseline, if you're able to perform the test and then the test is getting used to how you're doing from the start, then you could continue to monitor. But if you had any trouble with that or weren't able to be compatible with the device, again, we would take it back from you, but always better to try it out. And then the last question, Dr. Blemker, do you see patients? If yes, where are you located? Thank you so much for asking. I did practice for several years before making the switch to industry about 8 years ago. I am working with NoTal Vision as the clinical affairs director full-time, but I am located in Nashville, Tennessee. And thank you so much for asking. That's such a kind compliment.
Okay, well, I want to thank you, Dr. Bunker. This was very informative. And I also like to remind everybody to participate in the survey following this. It helps us plan these events in the future. And also, please go to our website, macularhope.org, and you can find future events. We have a lot of in-person events coming up, and all that will be promoted and you'll be able to see that on the website. So everybody have a good day, and thank you for your participation, both the presenters as well as the audience, and stay healthy.